Good afternoon. I am Dr. Sivaraman, Chairman, CuriHospital, Chennai Urology and Robotics Center in Chennai. Today we will talk about prostate gland and men's health. Prostate gland is a small gland the size of a walnut under the bladder. Through that only the urinary stream is coming out from the bladder to the urethra outside. So if you ask me, what is the function of this gland? The gland is, I'll show you a picture. This picture, you can see, this is the kidney. From kidney, the urine comes through this ureter and then it comes to the bladder. In the bladder, underneath the bladder, there is a gland called prostate gland, through which only the urine comes. So you know where it is situated now. Now, this gland has got few functions. One is, when the ejaculation comes, when the sperms come out from the testis into the prostatic urethra, this prostatic gland's muscle give a pressure to push the sperms outside the urethra. This is a pumping mechanism. That is one. Another is, there are some fluid component in the prostatic secretion which contains PSA, prostate specific antigen, and some nutritions. So, for the sperms to move into the vagina and then get deposited into the uterus, we need some energy that is supplied by the seminal vesicle and the prostatic fluid, which gives us some strength for the sperms to move ahead. Okay? And then once the sperms goes there and get deposited in the vagina, it becomes a clot, coagulum. For the coagulum to be dissolved and then again the sperms to move ahead, this prostate specific antigen and the fluids in the prostate help it. So mainly the function of the prostate gland is for procreation and help the sperms to go into the vagina and to the uterus. So otherwise, there is no big effort by the prostate gland. It is not a life-saving organ like your heart, lung, brain or kidneys. Okay? It is only mainly meant for the procreation to help the sperms to get better and get impregnating the women. So that's about the reason for the prostate gland. This contains fluid component for the semen as well as the prostate specific antigen. These two things are very important. So now the prostate gland, when it is normal, it allows the urine to pass by easily. After the age of 45 to 50, it starts enlarging. It is called benign hyperplasia of the prostate. The cells multiply and become bigger. The gland becomes bigger. Once the gland becomes bigger, what happens is, normally, this is the picture you can see. The prostate gland is here and the hole through which the urine coming is here. Can you see? So this is the hole coming. What happens is, the prostate, when it enlarges, this hole becomes smaller, like this. See? You can see this hole becomes smaller. So this hole becomes smaller, then the problem of passing urine comes. The person is not able to pass the urine completely. There is some residual urine which is not acceptable. See, when he strains to pass urine, the bladder gets very weak over a period of time. Because of that, there is some problem to the kidneys. So prostatic hypertrophy by itself first produces difficulty in passing urine, frequent passing urine because of incomplete evacuation, and then painful passing urine because of infection, and some blood in the urine also because of the infection. So all these things are the common symptoms. Why is it so important? Because the quality of life of a patient gets spoiled, reduced a lot, because in the night time he has to normally get up only once. But above the age of 60, when the prostatic hypertrophy is there, he is getting up more than 3 to 4 times. So every time he gets up for passing urine, his sleep gets disturbed. Once again, if you want to get a sleep again, then it takes some time. So the entire night, the person will not have proper sleep. Because of this, the next day, his work gets spoiled because of tiredness, because of sleeplessness. So this is one of the quality of life spoiling issues. Next is, if you allow the prostatic enlargement without any treatment, then this will spoil the bladder as well as the kidney, because when there is no complete emptying of the the urine stays back in the bladder. By staying back, it produces infection. It can produce stones. It can produce blood in the urine. And it can spoil the kidney because the pressure inside the bladder is more and the kidney is not able to empty the urine properly. So these are all the things which is caused by this prostatic hypertrophy. So what we should do and how to diagnose. The patient which is above the 50 years of old always have master health checkup every year. During the checkup, you have to specifically ask for prostatic specific antigen check as well as the ultrasound which sees the bladder emptying and the prostate size. These are all very important. When you do that, we can also see the uroflow test. When you have the uroflow test and also see a urologist, there is no point in seeing other specialists for checking about the prostate. You have to specifically go for a urology checkup, because the urologist with his experience does the examination, including the per-rectal examination. Through the rectal passage, he will insert a finger and find out whether the prostate is enlarged, whether it has got hard nodules, whether it has got pain. All these things can be seen. Once you have a hard nodule, then we have to check up the PSA to exclude any chances of cancer in the prostate. So for even benign prostatic hypertrophy, we have to do every year once checkup. In that checkup, we should include the PSA and the urologist. Normally, the patients who have this problem will come to the doctor for frequency, painful micturition, slow stream, and also nocturnal, nighttime passing urine. So we have to investigate that. The investigation includes ultrasound, rectal examination, uroflow, and the blood test for PSA and the urea creatinine. Once you do this test, the diagnosis of prostatic hypertrophy will be made. Once the prostatic hypertrophy diagnosis is made, we have to find out what is the degree of obstruction. Suppose if the prostate is very big and also the obstruction, there is a lot of residual urine, then first line of treatment is drugs, medicines only. There are two types of medicines. One is alpha blockers, which relax the prostatic muscles so that the urinary passage becomes little broader and the urine passes very easily. The next is dutasteroid. There is a group of drugs which produces the reduction in the size of the prostate. So at the same time, size of the prostate also is reduced and the passage is also increased. These two combination of drugs will help the patient to get far better. Usually, 90% of the people will get better by this, especially when you diagnose it early. So, but only thing is, these medicines have to be taken lifelong. It cannot be stopped in between, because once you stop the alpha blockers, the muscle tension will be more and the urinary passage becomes narrow again. So, if you are not going to have any surgery, it is only best to take this medicine for lifelong. So, these are all the two medicines which normally we give. Suppose in the case that there is a definite problem, like, when we should go for surgery. Surgery is only two types. One is laser prostatectomy as well as transurethral resection of the prostate. What we mean by that is, we don't do any holes anywhere. No cutting, no stitching. We have to pass the urinary passage. Through that we put a scope and then resect the prostate so that the passage becomes bigger. So there won't be any cut, stitching, anything. We do it through the passage of the urinary passage. So there is nothing big about it. It is a very commonly done operation. Only thing is, we have to do it only when it is absolutely necessary. Because we cannot just exhibit the operation for everybody. There are some specific indications when you should go to the operation. Suppose the patient has got recurrent urinary tract infection because of the residual urine. He gets urinary infection. We treat him with antibiotic. Again is better. Again after a month he gets again. Like that he got a recurrent urinary tract infection, which is very difficult to continuously treat with medicine. Number one. Number two is, if he develops complications of the prostate like stones in the bladder, because of the residual urine, the urine is not completely emptying, there will be chances of stones forming inside the bladder. That is another indication where you have to operate on it. Third is, continuously, recurrently got blood in the urine. The prostate can bleed, the bladder can bleed. So if there is blood, hematuria it is called, frequent hematuria, that is one of the indications for operation. Another thing is, because of the obstruction to the outlet of the bladder, there is residual urine which is preventing the urine from coming down from the kidney. Then the kidney has got no pressure. It has to simply come with gravity and some movements. Whereas if the bladder is full, the urine will not come in. So full bladder will produce obstruction to the urinary passage. I told you the ureters from emptying into the bladder. If the ureters are not emptying into the bladder, there will be back pressure effects into the kidney. The kidney gets enlarged. Then slowly, if you allow it to continue like this, the kidney gets thinned out. Then the patient will have a kidney problem like renal failure, hydronephrosis and renal failure. So these are all the indications where the medical management will not help, only the surgical management will help. Apart from the surgery and the medicine, there are some initial stages we can do some lifestyle modifications. Like in diet, suppose a person has got frequency of urination with the diet, like avoiding caffeine, coffee. Coffee is a very bad thing for prostatic hypertrophy because the frequency will increase because of the caffeine, because the bladder muscles are stimulated, so they will pass frequent urine. So coffee should be avoided. And then any drink after the time of 6 or 7 o'clock in the night, if you avoid, then the night time getting up will be reduced. So urine output will be reduced, as well as getting up to pass urine also will be reduced. So that is two things we have to do. Another thing is, green tea is supposed to be very good, even to prevent the cancer prostate. They say green tea has got flavonoids and also antioxidant and less of caffeine compared to the coffee. Hibiscus tea and green tea, both. Hibiscus means Sabapathy poo. So that tea is very good for prostatic health also. So regular exercises have to be done. People who are obese, with overweight and tummy fat, those people get more sufferings from prostatic hypertrophy and also cancer prostate. So people say regular exercise, weight control and proper care of the body will reduce the chances of prostatic hypertrophy and frequency of mixation and cancer. More than that, stress relieving. People who are very stressed, especially the modern world computer technicians, they are all very highly stressed people. When they get stressed, the pelvic muscles contract and the patient's passing of urine gets spoiled. So they get frequency, urgency and painful mixation. They say yoga, meditation, by doing this stress relieving, the patient's prostate health may be improving. So that is another point. Last but not least is taking plenty of water. Not after 6 o'clock or 7 o'clock, before that. Minimum of 3 to 4 liters of water will flush out all the problems in the kidney. The person will be very safe. So these are all the other things which you can do apart from taking the medicines and also the surgery. So now, prostatic hypertrophy has got benign hypertrophy as well as malignancy. Malignancy is cancer prostate. That is very common after the age of 50, and it is out of 78 per lakh of Indians have this cancer prostate. It is slowly increasing nowadays because our ultrasound testing, master health checkups, and the PSA blood testing are increasing now. Previously it was not. Another point is 50 to 60 years ago, our life expectancy was less than 60 or 50 years. So people used to die of natural causes before they get a cancer. Carcinoma prostate or cancer prostate comes only after 50 usually. So nowadays the life expectancy is increased. So up to 90, 95 very commonly people live. So they are having more chance of getting a cancer of the prostate. So in this scenario, there are a few things we have to look. To prevent prostate cancer, there is no chance because we cannot prevent it. The chances of getting prostate cancer can be reduced by our dieting. As I told you, the green tea, hibiscus tea, exercise, weight reduction, all those things will increase the chances of reducing the prostate cancer incidences. Another they say is, recently they have found that frequent ejaculations, like from 30 to 35 to 50 years, your ejaculations per month must be nearly 15 to 20 times. At that time, if you have that type of habits, then the chances of cancer prostate coming into your prostate is reduced by 30%. This is a study. It is being validated in other areas also. But it is information which can be reasonably believed. So, sexual intercourse or masturbation, whatever it is, ejaculation frequency at the age of 30 to 50 years or 60 years, up to 15 to 20 times per month may decrease the chance of your cancer prostate. After all, this is not a very difficult thing to do. So one of the things which we can try to prevent this is ejaculation. So apart from this, dieting and yearly checkup. Cancer prostate you should not be worried about because nobody should be afraid of cancer. You should be afraid of not detecting it early. Suppose if you have cancer prostate, if you detect it very, very early, then it is 95 to 99% curable totally. So early detection of prostate cancer is the main plank in which you should work on. Because every year master health checkup, anything you are having problem with prostate, immediately going and seeing a urologist, all these things will allow you to diagnose the prostate cancer very, very early. So in those situations, early diagnosis will completely cure the prostate cancer. Another, I don't want to go into the details of treatment of prostate cancer because BPH management is our main plan. Another point we have to worry is prostatitis, inflammation of the prostatic gland that comes in younger people like 25 to 40 years old people. They have severe pain while passing urine, and when they have ejaculation they have pain, and they also have frequency on. So then in these cases we have to do semen culture as well as urine culture and treat with appropriate antibiotic and also give them some alpha blockers to get the secretions from the prostatic glands into the urethra so that they will be completely cured of that. So recurrent prostatitis, you do long-term antibiotics and alpha blockers, they will be okay. Next, we'll have some touching about the prostate cancer. That is, if early diagnosis is there, there are three options. One is operation, another is radiation. See, and operation combined with radiation. All these three things can be done. Robotic surgery is the latest thing which has come into the picture. So they take the entire prostate out through the robotic assisted prostatectomy. There are only 2-3 holes in the abdomen. So the patient becomes mobile even the first day. So there are a lot of advantages. So robotic surgery and also the radiation, which has become very improved now. The side effects are very low. And suppose if the prostate cancer is beyond everything, then we have to do radiation and also chemotherapy. And there are a lot of drugs which has come recently which can be managed. Any questions? What type of lifestyle changes or needs to be adopted to make the treatment more effective? Roshan Sen, very good. Lifestyle changes, as I told you, is regular exercise, taking weight reduction and stress reduction by yoga and meditation, regular walking, and the diet, not indulging in extraordinary non-vegetarian diet, reasonably good diets. And actually eggs are also not very good, they say, because it contains choline as well as cholesterol that is also found in prostatic tissues. So too much of eggs need not be taken. Otherwise, we can do general supplements like omega-3 fatty acids, B complex vitamins, vitamin E, D, all those things can be supplemented. And regular exercise, yoga, stress reduction, and walking. What is it? What are all the complications of prostatectomy? It's a very good question. As I told you, simple prostatectomy is done through the passage, transurethral resection of prostate. We resect the prostate from this. What are the complications? First complication is the patient may have bleeding in the first few days or secondary bleeding after 50. These are all rare complications. Another is we'll have a incontinence for few weeks sometimes. That's only 1 or 2% will have this. That incontinence will slowly get better by Kegel's exercise and other possible medications. So that is another thing. The important complication people always complain is retrograde ejaculation. See, when the prostate is there, ejaculation comes through the urethra in a pumping mechanism. Once you take the prostate out, the bladder neck becomes little broader so that the urine passes very well. So when the ejaculation comes after intercourse, it goes into the bladder and not outside. So that will not harm your sexual enjoyment, but you cannot see the ejaculate coming out through the urethra. That is very puzzling to the patient. So we have to warn them that this will happen, and nothing wrong with that, because by the age of 60 or 55 when we undergo the operation, you would have finished this family. So no need of ejaculating the sperm into the vagina. Only sex can be done without any problem. So retrograde ejaculation is a small complication we have to bear with after prostatic operation. Any other question? Yes, exercise, yoga and relaxation will help the benign hypertrophy of the prostate also. Okay? Another point I want to tell you was benign prostatic hypertrophy is not a disease. It is never a disease. It is a aging process, like grey hair or putting glasses, having walking sticks, like that is. So don't think it is a disease which has to be cured. But this is due to a hormonal imbalance at the age of 50, it starts growing, then it is. So all the people who have prostatic hypertrophy will not have symptoms. Why? Because the prostate, when it enlarges, it will completely squeeze the urethra. Then all my symptoms will come. Suppose the prostate is enlarging on the sides, behind, towards the rectum, without squeezing the urethra, there won't be any symptoms. The patient will have a 60-gram prostate, but you will be passing urine well and you will not even complain to you. Everybody will say, oh, you got a 60-gram prostate. You have to see the doctor immediately. It is not necessary, because the size of the prostate does not correlate with the symptoms the patient is going to have. Sometimes a 20-gram prostate will enlarge only inside and squeeze the urethra so that he will not be able to pass urine. He will come to the doctor early. You understand? So it is a lifestyle changing disease, and it is not a disease by itself, and it can be cured easily by medicines, as well as when there is a very difficult situation only we go for operation. Which drug is safe in BPH among silodosin, tamsulosin, and silodosin is a recent advance. Silodosin is a recent advance. Tamsulosin, prazosin were there before, but latest is silodosin. Silodosin, they say, it has been advanced because it has got the cardiac side effects are less. See, tamsulosin reduces the BP to a certain extent because alpha 1A and 1B receptors are there in the body. Tamsulosin acts equally on alpha 1A and 1B. 1A is mainly in the prostate, which is useful for the prostatic hypertrophy. 1B is in the blood vessels. They will relax the blood vessel, and some amount of BP reduction is done with tamsulosin. But they say it is reduced, that side effect is reduced in silodosin. So silodosin is a recent advance, but lot of people are taking tamsulosin for 30-40 years. They didn't find any difficulty. They were also happy with this. So I cannot tell you the definite difference, but it is claimed that silodosin has got better cardiac side effects than the tamsulosin. Whether alcoholic intake will affect prostate size? No. Alcoholic intake. Normally, I am a teetotaler. I don't like people taking alcohol in excess. Okay? So you are talking to a wrong person. But I don't think there is any benefit written in the history or in science or in arts anywhere else in the world that alcohol intake is very good for health. Okay? So alcohol intake should be avoided. Especially if you take beer, it produces a lot of urine. If prostatic hypertrophy patients take beer, they will go in for retention. They cannot pass urine because excess of urine is produced and the prostate is not allowing it to pass. So they go for retention and they go in for catheterization. They have to put a tube and take. So I won't say it affects the prostatic hypertrophy, but it is not good to have excess alcohol in any way for any disease. At what age should men go for regular period? After the age of 45. Suppose what age the men should go for PSA? This is a very good question because normally above 45 to 50. But if your father or anybody in the family had cancer prostate, then they should start examining at the 40 itself. Because once the person has got cancer prostate in his genealogy, genetically prone for getting CA prostate, so he has to do it early than the other people, normally 50 years. And what precautions should be taken during the pandemic? Oh, this is a very good question. I have taken the mask only now just to make sure that you see, and I have sent all the others outside. So always wear a mask, including your nose, cover it. And wash your hands frequently wherever, whatever you touch. And also keep the social distancing. And do not hesitate to consult a doctor even if the slightest symptoms like fever, mild cold, cough, difficulty in breathing. Anything happens, immediately consult because their COVID virus can be asymptomatic and suddenly flare up. So now there are a lot of medicines which are controlling the COVID virus, and you will see that the death rate has come down all over the world, also in India. So our cure rate is increasing. So best is to avoid contacting COVID virus, but if it comes, go for treatment early. Don't hesitate saying that it may not be COVID. That you don't decide, you ask the doctor to decide. As our diabetic and hypertensive patients are more prone to BPH.